Doing this again because this helped me last time. Okay, health assessment. True or false? Pain is considered objective data. Ow, my foot is really, really hurting. Can I prove that to a nurse or a doctor? No. Pain is subjective. Everybody's pain level is different. You cannot prove it other than with objective data, which would be, yes, exactly, vital signs, different things. 2. Which type of nursing assessment is completed when a patient follows up for a previously diagnosed pneumonia? Comprehensive, problem-based, follow-up, or a screening? Okay, well, a screening, we can knock that out because that's preventative. Comprehensive, we know it's pneumonia. Problem-based could be that, but it has been previously diagnosed. That is a follow-up, or also known as episodic. Problem-based would be walking into like a urgent care because you think you sprained your ankle. Comprehensive is everything, as it's in the word. Which of the following is an example of non-verbal communication to avoid? Smiling? No. Excessive eye contact? Sitting at eye level or active listening? Which of these things is not like the other? Do not be freak about eye contact. Okay, true or false? When you are giving a physical exam, what is the first thing you should do? Is it inspection? Should you inspect who you're going to give the physical to? Yes, that's true. Inspection is always the first technique used in the exam. Think of the little circle we had. Which percussion tone is normally heard over the stomach? Okay. Is it resonant? Oh God, my pronunciation. Dull, tympanic, or hyperresonant? It's tympanic. Think of your tympanic membrane in your ear. It's hollow. Okay, that's not bad. That's a bad example. Resonant is going to be heard over the lungs. Tympanic is in the stomach. And hyperresonant is something that you find, it's like an abnormal finding. You do it with emphysema. That was just what was written. And then dull. I don't remember what dull is. We'll come back to that. We won't. Okay, which of the following vital sign indicates a hypertensive crisis? 120 over 80, 100 over 60, 180 over 120, or 90 over 70? Okay, we have what we want, 120 over 80. We have a little on the lower side, but like still within your normal range, kind of where you want to be in between these two. You have really, really high, hypertensive, and then you have pretty low. I mean, I forget what she said about how low you don't want to be, but that's pretty low. Hypertensive, crisis. That would probably send me into a crisis 180 over 120. I mean, that's a pretty big jump from normal. Braden scale is used to assess patient risk for what? Falls, pressure injuries, malnutrition, or osteoporosis? That's right, pressure injuries. What can you remember out of there that you assess? Nutrition, friction and shear, moisture. Is this patient shitting themselves to the point where their ass is always wet? I don't know. Hold on. Yes, okay, that's right. How are they with it? Can they move themselves? Mobility. I already forgot what it said. Can they feel? Can they feel when maybe their butt's hurting a little bit? And yeah, I already said that. Can they move? Can they help themselves move? Can they roll over? Are they going to be winded? Is it going to be a 10 out of 10 exertion if they have to pick themselves up and readjust in the bed? Follow-up question. What is a score on the Braden scale that would require some hospital intervention? Yes, the book says 18, Some hospitals say 16. No, flip that. Flip. Oh wait, no, don't flip that. 18. Yeah, 18. Hospital intervention. Okay, I'm pretty sure the book says 18, or the book says 16. It says one of them. Okay, just ignore that. Okay, true or false? A vesicle is a small fluid-filled lesion seen as those in chickenpox. Is that true or false? I'll give you a second to think about it. That's true. Yeah, just think of I can search up a picture if that'll help. Oh, yeah, look. That's kind of fluid-filled. Okay. Um, which musculoskeletal change is commonly expected in older adults? Increased muscle strength, kyphosis, hyperextension, or decreased joint calcification? Hmm. Well, are they getting stronger as they get older, or are they getting weaker? So we can knock that one out. Are they getting way more flexible, or are they getting a little bit more stiff? Yes, we can knock that one out. Okay, now we're between these two. Decreased joint calcification and kyphosis. Do you guys remember what that is? That's like a humpback kind of thing. Like a oh my God, I spent my whole life, ripping up carpet and then putting carpet nails in the ground. Now I have a permanent like curve to my back. Or decreased joint calcification. Decrease is going to be the big word. You're going to have increased joint calcification. Your joints are going to get stiffer. So the answer is kyphosis, even though this doesn't really happen to everybody. Whatever. Okay, which laboratory result suggests anemia? Let's think about what anemia is. That is decreased hemoglobin. What do hemoglobin do? They carry oxygen on your red blood cells. You need iron. If you have low iron, you have low hemoglobin. Iron deficiency anemia. It can also be caused by other things. You can be dehydrated. You can be, oh no, okay, no, they're just kidding, just kidding, just kidding. You'd be high if you were dehydrated. Okay, if you're male, would it be, oh crap. Sorry, guys. I didn't read the question. I mean, I did, but I gave you, it's hemoglobin. You know that's the anemia one. The question is, if your male is 14 low or is 9 low? Yes. This C is the answer. Hemoglobin of 9 grams per deciliter. The average, if you're a girl, you're going to have, I think it's 12 to 14? 12 to 16. Girl is 12 to 16. Boy is 14 to 18. So you have a range of 4. So yeah, you want to be anemic, you have to have less than, basically less than 12 or less than 14. Okay, a screening exam is focused on early detection of a disease, such as cholesterol test. Yeah, I mean, let's just think of like a mammogram. That's early detection of breast cancer. Which communication technique should the nurse avoid when interviewing a patient? Using open-ended questions. I actually skipped this question on my initial going through this. Interrupting the patient, active listening, or clarifying responses. I mean, come on. We're not dumb here. These questions are a little too easy. Which temperature site is most accurate for core body temperature? Oral, axillary, rectal, tympanic. Follow-up question. What are the values of each of those? Answer the question first, though. Okay, yes, you're right. Rectal is the most accurate. We don't do it, though, because if somebody tried to stick a thermometer up my ass, I'd be pretty upset. So, oral, I think you keep the same value. Axillary is +1. Wait, no, I'm pretty sure rectal you have to -1. I don't know. Hold on. Let's fuck that. We're not listening. Tympanic? What is tympanic? That's forehead. Okay. True or false? Decreased skin turgor can indicate dehydration. I mean, come on now. Yes. And then, where do you test skin turgor? Is it the dorsal part of the hand? No. Why? Yes, because old people have less elastic fibers, so it's not as reliable, but also they're a little bit more fragile. You stick a vein in their hand, or I mean, you stick an IV in their hand, what's gonna happen? That vein's probably gonna blow. Uh, which finding is considered abnormal during a skin assessment? Warm, dry skin, moist mucose membrane, foul, strong odor, fall. Am I having a stroke? Foul odor? No. Strong foul or odor. What the fuck is happening to me right now? Strong foul odor from a wound or pink nail beds. Yes, it's the fucking one I can't say. It smells bad. That's not normal. Which range is considered normal, a normal adult respiratory rate? I'm not even gonna read the questions out because we know this. It's 12 to 20 breaths per minute. True or false? Osteoarthritis is characterized by degeneration of joint cartilage. Oh, yes. Or is that osteoporosis? No, it's osteoarthritis. Osteoporosis is degeneration of bone. You get fragile bones, you break a bone, you say, whoa, that was weird. Why did that bone break so easily? And they say, you have osteoporosis. And you say, damn, why is that? And they say, well, you're a white female postmenopausal above 65 who smoked and had a very poor diet of no calcium or vitamin. What vitamin was it? I think it was vitamin K, but it might not have been. It was vitamin D. Okay. Yes, that's what they would say. Which type of lesion is elevated, firm, circumscribed lesion deeper in the dermis than a papule? That's right, it's a nodule. Papule is kind of on top, but it's the same shit as that. Nodule, it's just deeper and it's like hard when you press it. Wheal, that's a hive. Vesicle, that's fluid filled. And plaque, don't ask me what that is. Which dietary method involves a patient recording food as they eat? Well, let's think about this. Is it food frequency questionnaire? Is it a 24-hour recall? Or is it food diary? This is actually, yeah, food diary is the right answer. This is retrospective food frequency. This is where they ask you to like, no. These two things are together. No, sorry. These two things are together. That's retrospective. This is prospective. I don't think we'll be, yeah, I'll probably ask the vocabulary words. Okay, true or false, vitamin K can lead to bleeding compilations such as Pikachu and Nicamagus. Read it. Look at the screen. I'm not reading these fucking words. I don't know how to say them. Pikachu and Nicomosis. That's bleeding. Sorry, I'm pointing with my finger. This is bleeding. Or it's like little red to purple, like little spots. And this is bruising. So let's think about it. That's blood. Bleeding complications. Vitamin K. What is vitamin K? Vitamin K helps with your clotting. That's a clotting factor, I'm pretty sure. Or at least it helps with factor. So you can go ahead and say true. What position do you want to be in if you're gonna what position do you want to put someone in if you're gonna stick a temperature up their ass, a thermometer up their ass? You want them on their back? You want their punani out? You want them on their side? Or do you want them on their stomach? You want them on their side. You actually want to lay them on your left side. We learned that in lab today. True or false, Pikachu are small red or purple macules associated with bleeding disorders. I mean, if you're paying attention, you know that that's true. Okay, which of the following is considered a secondary lesion? Is it a macule, plaque, a wheal, or an ulcer? I don't know. Let's think about it. What is a secondary lesion? It's something that comes from a primary lesion. Which of these are primary? 3 of them. So you could say an ulcer is probably secondary. It is. What is the normal value for fasting blood glucose? Okay, well, this is high. They said that that's not normal. I'm pretty sure it's 60 to 105, but everybody says different. It's this one. It's 70 to 105 milligrams over deciliters. Okay, true or false, kyphosis is a common musculoskeletal finding in older adults. It's true. I need to make another one that has different questions that are maybe a little harder. Yes, it's common. I don't know how really common it is for it to be so severe, like how our examples are. But, think about all the old people in your life. Their backs fucked up. Okay, here. Which site is most reliable for assessing skin turgor in elderly patients? Is it the dorsal part of the hand? Is it the forearm, the clavicle, or the palm? Well, we can say it's not going to be the hand because we already did that. Palm is connected to the hand. This is a thing. Clavicle is going to be your number 1 choice. If you can't do the clavicle, the forearm will suffice, but your first choice is always going to be the clavicle. And I don't know why you wouldn't be able to. Maybe they have a chemo port on one side and they have like a secondary chemo port on the other side, and it's the world's biggest chemo port, so you can't pinch it at all. Which finding would indicate dehydration, increased blood pressure, slow pulse, dry skin, and decreased turgor, moist mucous membranes? These questions are fucking ridiculous. Yes, it's dry skin and decreased turgor. We've had 3 questions about, does turgor indicate decreased turgor, and can it indicate dehydration? Yes. Which finding would indicate dehydration? Decreased turgor. It's fucking stupid. Hyperresonancing is expected over healthy lung tissue. No, do you remember what lung sounds are? That's right, resonancent. Hyper. That is the one that is heard over like abnormal masses. Okay, which nutrient deficient is associated with bleeding gums and poor wound healing? Well, iron. We know it has to do with blood, but not necessarily bleeding. Vitamin C, if you don't have vitamin C, you get scurvy. Yeah, you get scurvy. Calcium, you don't have calcium, you get brittle bones. So you know it has to be vitamin K, but you also can connect it because bleeding gums, bleeding, factor, you can't clot, your gums bleed. We learned this in patho. Okay, here is a thing that I don't think we learned in class. It is in the book. I'm going to go over it all the way. Which muscle strength grading indicates full range of motion against gravity with full resistance? It's 5. The highest score goes to 5, lowest score goes to 0. So your 4 is going to be full range of motion with gravity, or against gravity with partial resistance. So you're getting a little help. 3, full range of motion with against gravity. Let me just, because in case I fuck this up, I'm just gonna fully be able to say everything right. Okay, yeah, that's right. With some resistance. Then you have range of motion with gravity. So 4 or 5, full resistance. We can do that easy. 4, we're struggling a little bit. 3, we can still do it, but it's hard. 3, we cannot do it with gravity. Gravity needs to be taken out of the equation, and then we have full range of motion. So that means I can put my arm down, but maybe I can't rip my arm up. But if I have something assisting me, I can. And then 1, you can you have a little range of motion. And then 0, obviously, score of 0 is you can't do shit. Yes, so there's this. I'm gonna probably make another one. I'm gonna tell it to make harder questions because these are a little too easy. Oh, and look at the answer key. It like gave me a cute little thing.